So this is the session on temperature monitoring and performance management of cold chain equipment. My name is Brian Powell. I'm an engineer with New Horizons. And today with me, I have pharmacist Abubakar Sani from Bauchi State in Nigeria and Ernest from Kenya. And we're going to be talking about CCE reporting with the Varo Android application. We'll give an introduction to the Varo application and show how users would use the application to collect 30DTR data. And then we'll talk through a couple of country use cases to show where Varo has been used in both Kenya and in Nigeria to collect data. So to set the stage for the challenge that Varo was designed to address, inadequate visibility into real-world CCE performance has been a long-standing challenge. And we developed the Varo Android application to provide a tool for users to get access to the 30DTR data that are being collected by fridges. So they plug the 30DTR logger into their Android phone, the data are downloaded by the phone, and they put together a machine-readable email report that can be transmitted to their EPI program. So to show how Varo can be used in health systems to help address EPI challenges, we have a short animated video to show this.
Medicine can save lives, stop diseases, and keep us all strong and healthy. These supplies must be stored at the right temperature, so each refrigerator is very important. But keeping everything safe and effective can be tricky. Tracking power fluctuations, equipment malfunctions, or temperature changes can overwhelm us, and every problem feels bigger when you are disconnected and alone. That's why we must work together. Just as our phones help us every day, they can help here too. With Varo, we can collect temperature reports right away and send them to anyone. Varo shows you the record then and there. Get important details like location and photos. The phone makes it quick and easy. You control who gets the report. It all adds up to a powerful way for each of us to join the solution. Nurses, technicians, anyone can use Varo. Supervisors can even tell when it's time to step in. Together, sharing information, our connections create action. And our vaccines continue saving lives. Create the connection with Varo. Available for free on the Google Play Store.
So that's an introduction to the Varo application, but let's take a look at how users would actually use the Varo app to collect data from 30DTR loggers. So users would pull the 30DTR logger out of the refrigerator and then use a small USB adapter called an OTG adapter to plug that logger into their Android phone. The Android phone then downloads the data automatically from the logger and asks the user to answer a few questions about the cold chain equipment. They'll take a couple of photos of the fridge, scan any barcodes that are available, and select the make and model information about the fridge. They then just send the email and they're done. So really it's just three simple steps. Connect the logger, download the data, answer a few questions, and send the report. So now we'll talk through a couple of case studies to show how Varo has been implemented by EPI programs in both Kenya and in Bauchi State in Nigeria. So now I'm going to hand it over to my colleague Ernest from Kenya.
My name is Ernest from Kenya. I work for the Ministry of Health, National Vaccines and Immunization Program. I'm the Chief Technical Officer, Cold Chain. We rolled out the Varo app during the nationwide 2019 cold chain inventory exercise. We conducted a two-stage training, whereby in the first stage, we conducted a national training where we invited 2 participants from each of our 47 counties. From there on, these participants were supposed to go back to their respective counties and conduct the same training for their technicians. So at the national, we took them through Varo and handed the OTG adapter cables to them so that they can be able to use that to collect data. At the second level, which was at the county, they also conducted the same training to the biomedical engineers at that level and handed them the adapter so that they're able to be able to collect the inventory data from the health facilities that they were going to visit. Over the course of the inventory exercise, we managed to receive a total of 4,218 email VARO reports transmitted. This gave insight into both the cold chain equipment performance and the value of the VARO tool for data collection. An example of the report that was sent and received is as can be seen on the right-hand side. We received a PDF report, and we also received pictures for the refrigerator, that is the picture of the refrigerator, the picture of the data plate, which they were supposed to take, the data plate or the nameplate, and they're also taking picture of the fridge tag. We were able to also see other features like the name of the facility, the GPS location, and the like. Building on this experience, the National Vaccine Program is rolling out VARO for sustained monthly use. The goal is to make cold chain equipment report generation a normal recurring activity. VARO tool becomes a part of everyday process. All EPI personnel should be able to submit VARO reports when they visit facilities for any activity that they do, such as inventory, supervision, and the like. Monthly report generation by health workers is planned to be rolled out in this Q4 of 2020 in 3 of the counties, then to scale it up nationally thereafter. Recurring 30-day temperature recorder collection activity with VARO is planned to inform more targeted maintenance, intervention, and a proactive practice towards maintenance of cold chain equipment. Thank you for that. I'd like to hand over to pharmacist Abubakar.
Okay, thank you very much, Mr. Ernest, for the presentation. My name is pharmacist Abubakar Sani. I'm the Assistant State Logistic Officer from Bauchi, Nigeria. VARO was first deployed in Bauchi State by Global Good in 2018 together with their training. During that time, eHealth Africa had contracts of vaccine delivery to health facility and CCE data capture using the VARO application. Next slide. But in 2020, the state took over all this process of vaccine delivery and CCE data capture. Okay, let's look at the CCE data review process in the states. VARO reports are reviewed monthly as part of the State Logistic Working Group meeting, and this creates a clear pathway for addressing problems. How does it happen? At the end of every month, the vaccine delivery drivers deliver vaccine and at the same time collect CCE data using the VARO application and send it to an email which is set up by the states. After then, the state logistic officer and the other team analyze the data and discuss on the findings from the VARO reports. And the next necessary actions to be taken depends on the analysis from the VARO assessment and the meeting. And some of the actions taken include deployment of technicians to repair a non-functional CCE that were found due to the VARO reports, or deployment of human resources to conduct spot checks and find out the actual causes of the persistent alarm rate from the CCE, and also to provide on-the-job training. With regards to the report collected with VARO, since from the deployment in the state to date, more than 2,000 VARO reports were captured in the state. And also the number of alarms had decreased from 36 to 4 over the last quarter using the application. Now, it is very important to mention that the state also uses the VARO application to prioritize and identify health facilities that need replacement of new fridge tags. So in conclusion, having a CCE data is very, very important in the states. And there is already an existing process in the states, that is SLWG. So merging the two together gives the states utmost visibility into CCE monitoring and functionality. Thank you very much. Let me hand over to Brian. Thank you very much.
Thanks, pharmacist Abubakar. So before we wrap up, I just wanted to revisit how data flow with the VARO application works. So CCE temperature loggers live inside the refrigerators and save temperature data. And then the VARO Android app is used to download those data and attach additional data points such as photos, location, make and model information, and facility information. Then the users email those reports to a Gmail account that's been established by EPI for data ownership. API managers can then log into that email account to review the VARA reports directly. But clearly, if there are hundreds or even thousands of VARA reports, reviewing each individual email would be quite time consuming. So we've also developed a tool called Pogo LT, which is a little free Windows application that users can install on their local computer. When they enter a date range and the email login details, it will log into that Gmail account and download the appropriate VARA reports from that date range and convert them into a single aggregated summary showing the overall performance across all reports in a single PDF file. So that's the VARA application. It's a simple free smartphone app that can be used to collect 30 DTR data from those loggers, along with photos, location, and other information to put into a standard email report. This app's been implemented successfully by API programs in multiple countries. And for more information, feel free to visit varo-app.org or email us directly at datatools@nhgh.org. Thank you.
My name is Ngwegwe Christopher Bulula. I work with the Ministry of Health, Expanded Program Immunization or IVD in the United Republic of Tanzania. And I'd like to share the Tanzania experience and vision for the end-to-end cold chain equipment visibility being the role of the remote temperature monitor devices. So with the support from GSI and Next Leaf Analytics, as well as Gavi and Elma Foundation, we are starting now to introduce the remote temperature monitoring devices at our health facilities, as well as some of the district vaccine stores in August 2017. And the aim was just to improve the cold chain performance, making sure that the vaccine that are delivered to our clients are of maintaining potency as well as facility. Now, for the rollout of the RTMO remote temperature monitoring devices, as I've said, we introduced it in 2017 in August with the support from Gavi, Next Leaf Analytics, as well as GSI. So phase one, we roll out about 2,000 of the RTM devices, and the green in this map, this shows the regions that we have installed. And so about 2,000 of them. And as I'm speaking now, we are continuing the phase two of scaling up the remaining 3,000 remote temperature monitoring devices of the cold trees. And we expect by April 2021, will be already finished covering the main all regions, which are in yellow. And we expect again before end of next year, we will also cover the remaining 1,500 facilities in the country. Our intention is to make sure that all immunizing health facilities in the country are installed with the remote temperature monitoring devices. The good thing on the use of the RTM devices is that whenever there's a temperature excursion, they can send an SMS remotely to our nurses or healthcare providers so that they can take an intervention whenever there's an excursion. And if it does not respond to the excursion, it means that the higher level may be able to take an action. This is just an overview on how the remote temperature monitoring devices works. So the RTM or the cold trace unit itself, it has two parts. One is the dashboard and another one is the unit, which whenever there's an excursion, it just send an SMS to an immediate supervisor. And at the facility level, this is the healthcare worker who are managing the vaccines. So they have to respond to that. If they will not respond to the excursion, the SMS will be sent again to the next level, to the district and even to the region and the national level, so that we can take an action for that excursion. Now, with the introduction of the RTM, what we've done now as a country, in order to avoid having different dashboards for our district immunization officer, we have integrated the cold trace dashboard within the electronic logistic management system of what we call the vaccine information management system. So the dashboard for the cold trace is integrated with the VIMS, and this gives the visibility of all the functions, not only of the stock, but also the functions of the cold chain equipment. And it has helped in the district immunization officers in the sense that by knowing the functionality of the cold chain equipment, because they have the real time on the dashboard, whether this facility, the cold chain equipment is working or not. Now they can plan ahead whether to proceed with the distribution or not to proceed with the distribution, because they have all that visibility just using the dashboard from the vaccine information management system. Now, this is just the benefits of integrating the two systems, the call trace of RHM as well as the vaccine information management system. Just comparing the 2 months from July and December, we see the completeness has been improved from 76% to 95%. And this is because they are not working on different dashboards. It's just the same dashboard, just the vaccine with all the integrated with the RHM. So it has improved in terms of completeness because of the visibility that the district and regional immunization officer have on its cold chain equipment. Before that, it was difficult. What are the actions that have led to improvement in cold chain equipment performance? First of all, there's an improvement of the time that the cold chain equipments work at optimal time. That means at 2 to 80 degrees centigrade. If you compare on this data from January to September 2020, we see an improved of uptime to most of our cold chain equipment. From January up to October, they were above 85%. And this has been contributed because of the visibility of what is happening at the facility level. And therefore, either the healthcare worker at the facility may be able to take action, but also we see those at the district and even region, because they know now facility X has a lot of alarm, now they intervene and also go to make correction for that. And that's why now we see an increase in uptime of our cold chain equipment. This graph also shows the changes or the improvement in terms of cold chain equipment. Look at this in terms of the freezing, but now has been, uptime has been increased from 84 to 86.7%. And this is because of the introduction of the RHA. But also, if you look on the freezing alarms, has been reduced from 7.2 hours before we introduced the RHM into 1.2 hours only after the introduction and activation of the alarm system in our health facilities. But among the factors that have also contributed to improve uptime, one of it is because of the support from our managers, the district and regional immunization officers. Sometimes they provide the remote support to healthcare workers whenever there is action, there is an excursion. But also through supportive supervision, there has been an ongoing job training to our healthcareers on how to work on whenever there's an excursion, how to troubleshoot those problems. But also the repair and maintenance of our cold chain equipment. Now, because we have the data, it has been easier now to send the spare parts for the cold chain equipment so that it can be maintained. And because of that, we see an increase in uptime. But also we see a good response from the management, both at the region and district. And this means the regional medical officer, the district medical officer, now they're very supportive because of the data that has become visible when the district immunization officer and the regional immunization officer share with them. Now they provide a lot of support to ensure that the cold chain equipment function. This is just an example of one of the dashboard from one of the facilities. As you can see, this the way the cold chain equipment was behaving. The temperature was very high throughout from 26 March up almost to 29, 3 days, the temperature was above 80 degrees centigrade. But with the dashboard and the intervention of the district by using the national immunization officer technician, they were able to rectify that one and therefore to see the temperature coming to normal. The problem of this facility was just the gaskets, which was worn out. And this also is another example of a health facility whereby there's an up and down of the temperature because of the thermostat was not properly set up. But because of this visibility, the technician were able to go to the health facility and rectify that one. And as I've said, again, we have used the remote temperature monitoring devices to measure the performance of our cold chain equipment. And this, there are two types, those which were under the CCEOP and those which were not under CCEOP. So we see a big difference between the two, whereby by the cold chain equipment that were under CCEOP, we see the uptime was almost 96.2%, with a very minimal which indicates freezing as well as high temperature. But the coaching equipment which were not under CCEOP, we see the uptime was very low, was about 81.8%, and some of them, about 7%, they were heat excursion, the high temperature, but also they were freezing, about 8.3%. This is also the dashboard which, by using the ARA team, we were able now to know the functionality of different models of the cold chain equipment. If you look on my left-hand side here, this is the type of the cold chain equipment with the solar, whereby the number of them, almost more than 20–30%, they indicated they were heat alarms, but all the uptime was only 65%. But if you compare with the cold chain equipment, the solar direct drive refrigerators and the CCEOP, we see almost 96% or even more of them, temperature was within the recommended of 2 to 8 degrees centigrade. And a very few, 1 or 2 or 3 of them, that they have heat excursion. But other models being RC50, 42, RC50, and other different models, we see they behave differently depending on the model. But the good things about it, the ARA team now has been able to give us this data and therefore help to plan in the future when we are doing the selection of the cold chain equipment, because we have the data now, we know which one works well in what area. But also with the use of ARA team, now because we have the visibility, we see action, the district and the regionalization officer, now they are taking action to ensure that the cold chain equipment are working properly. And therefore, we have seen a trend of decreasing the number of alarms. For example, from June this year, they were almost close to 3,000, but now up to October this year, it's almost less than 1,000. So this is a lot of improvement in case of the functionality of our cold chain equipment. But the ARA team itself is one thing. The technology, yes, is good, but we need people who are very committed to ensure that the success of the technology is implemented properly. But also we need the processes are very important, because we need, it's a mixture of the three, the people, the technology, and the process, and also the leadership and the resources to make sure that the intended devices, they work the way they are intended. Otherwise, you can have the technology, but it may not help if you don't have the people who are committed, but also if you don't have the resources to ensure that it is implemented. So what we've learned with the remote temperature monitoring devices introduction in our country, first of all, there are a number of challenges. The first one of the challenge is about the network. In order for the ARA team devices to work, they need connectivity. They need the mobile, they need the internet connectivity. Now, in areas whereby there is a weak connectivity, the device cannot send an SMS. And therefore, some of the area, we just went to remove them because the coverage is very low. But we have noted it also during rain season in some of the areas, the mobile towers, they do not, the signals are sometimes they're not very strong. And therefore, the devices, they are unable to send the SMS. But also, as I've said, in areas whereby there's a weak internet, it means that the devices cannot send the SMS. But also we have noted a number of breakdown of the sensors because of the connection, but now we are improving the way how we install the cables to the cold chain equipment. Another challenge we found is the turnover of the staff is very high. You train this staff, now if you left, come a new one, it means you have to mobilize the resources to go back again and train our healthcare workers. But another thing that we've noted is about the integration. As I've said, we have avoided to have multiple data dashboards. Now we have only one dashboard from the Vaccine Information Management System, which also picks the data from the cold trace dashboard. Now, in order for the cold chain, for the Vaccine Information Management System to pick up the information from the cold trace dashboard, they must match that cold chain equipment serial number must be able to match the one that is in VIMS and the one that is from the cold trace dashboard. And this has been a challenge in some of the area whereby you find the serial number is a bit different from the serial number of the cold chain equipment has been uploaded in VIMS. If there's mismatch, it means that facility cannot be picked up on the VIMS. But we're working on it to ensure that there's alignment of the cold chain, of the serial number from both the two systems. Now, with the cold chain equipment challenges, now as I've said, the RHM has helped us to come with the visibility. It means now we have noted now a number of cold chain equipment are not functioning well and they require spare parts. So sometimes the cold chain equipment continue not to function well because we didn't plan and we didn't budget for the spare part at that time. But now with the data, we've come up with a good plan for procurement of the cold chain spare parts. But again, with the over 5,000 now of facilities that will be installed with the RTM, it means a lot has to be done in terms of maintenance, especially with the old cold chain equipment. They require the spare parts. But again, one of the challenges that at the district and regional level, because this is the new thing, there is no any review meeting specifically for cold chain. We have review meeting for immunization data for coverage and others and the health and other issues. But now the information, probably by next year, we're negotiating with the local government so that we can have this review meeting just specifically to talk about the cold chain equipment functionality. But another one is about the reliable power as well as stabilizers. Having, as I've said, having technology is one thing. We need to have a strong leadership that will be able to support whatever comes out of the RTA. We have seen in some of the regions, because of the strong leadership of our district and regional immunization officer, they provide support for maintenance of the cold chain equipment. This is very key. Otherwise, we can have the data and then nothing can be done on it. Again, we are establishing the technical support team for sustainability to ensure that whatever data has come from the lower level can be able to discuss at the higher level and therefore help in strategic planning. But also what we've learned now, we need the financing for preventive repair and maintenance that has to be budgeted to ensure that all our cold chain equipment are functional. The data has helped us not to know the gap of the deficiencies that we have in spare parts, but also there is a need of continued training of our health staff, especially because of turnover. And this is the technology, therefore they need on-job training, continuous follow-up to ensure that the cold chain equipment are functioning, and the information that comes from the RA team now can be able, decision can be made from that one. So at the country, we are, as I've said, by 2021, we're expected to scale up over 6,000 cold trace devices. And what our intention that we want 90% of our cold chain equipment to be, the temperature to be recorded within 2 to 8 degrees centigrade. That means the uptime to be over 90%. But also we are proceeding with the integration of the dashboard from the cold trace as well as for VIMS in order to have the real-time synchronization and updates. And as our partners will be, their finances or support will be declining, we are expecting to have the country ownership. We've already started discussing with the local government authorities on how to ensure sustainability of the program. As well as, as I've said, we are establishing the technical support team at the national level to ensure that whenever challenges happens at the lower level may be able rectified. Thank you very much. Asanteni sana.